medical imaging consultant is a reference text specifically designed for referring physicians and for radiologists to be able to find the best imaging study to do for a patient with a given condition. So, for example, if a patient has a cough, one of the questions would be, do they need an imaging study, and if so, what's the first imaging study to perform? So in the imaging consultant, it's actually designed for the referring physician to be able to look in the textbook in a series of tables, it's a series of tables basically, that gives information about multiple medical conditions. So it includes the CPT code for the procedure that's being performed, the Medicare allowable cost, the chest x-ray equivalent radiation dose, the millisievert radiation dose, the relative risk and benefit of the procedure, including whether or not the examination includes things like contrast, and allows the physician and the patient, together with the radiologist or the individual performing that procedure, to make an informed decision about, one, is this the right test? Two, is the risk-benefit ratio appropriate? That is it worth the risk to gain the benefit of the test? And then finally, what is the relative cost of that procedure, and what is the final outcome in terms of risk and outcome risk?
RadSite and Health Help are really pleased about the publication of the 4th edition of the Medical Imaging Consultant. Early on, we decided that if it's appropriateness and it comes from the literature, it's not proprietary, it's part of the general good and in the public domain. But we wanted to put it into a little book that was easily used by the person ordering the radiology. Not something that they had to go get into the books and study, something that fit in their lab coat pocket or could be easily used off of the desk. So the 4th edition covers radiology, radiation oncology, cardiology, what is the best test. And you'll find it interesting when you have a chance to look at it, because it also has all the safety features. There's a column that shows how many days of your life are lost by the radiation you'll receive by that test. And of course, if it's an MRI or an ultrasound, it'll be 0. If it's a CT study or a CT with contrast, it'll be much more. But you'll be getting that test with information about safety, about quality. You also note that it doesn't have just one test, because patients are different. They have different sets of conditions. And even though the one best test is at the top of the column, maybe there's a reason a patient can't have that test. They've got metal in their body or a metabolic disorder that causes the contrast not to be able to be used. So you can look at the second one or the third. If you want to order a book, you go to www.radsitequality.com.